Okay, so I have 7:03 on my clock, so why don't we get started? Good evening, everyone. Thanks for joining us on our OHT flu season planning webinar. This webinar will be recorded and we will be sending a link out sometime next week through the Ontario Health Team mailing list. If you have any questions during the webinar, please use the Q&A and we'll do a Q&A session at the very end. This webinar is not Main Pro accredited, but you can go into your CFPC Main Pro account, and there's actually something called COVID-19 Learning on the Go. So you could actually use your learnings tonight to fill in a survey on your Main Pro account for up to 2 credits. So for those who don't know me, I'm Emily Lamb. I am a family doctor in Markham. I do home palliative care, and I am the Ontario Health Team primary care lead for the Eastern York Region, North Durham Ontario Health Team.
Hi everyone, I'm Carly Jensen, and I'm the chief at the Uxbridge site.
Hi everyone, I'm Colleen Briggs. I'm a director at Home and Community at Central Lynn.
Hi everyone, I'm Pearl Yang. I'm a family physician at Stouffville Medical Center.
So I'm gonna just a quick plug for our Ontario Health Team. So the Eastern York Region, North Durham Ontario Health Team covers Markham, Stouffville, Uxbridge, and Brock. And this is really a collaborative effort between primary care providers, residents of the region, caregivers, persons with lived experiences, community service providers, the hospitals, long-term care facilities, the regions of York and Durham. And the idea is that under an Ontario Health Team, we can really provide integrated collaborative care for all the residents that we serve. If you would like to join our primary care OHT mailing list, please email me. So my email is right there, Emily Lamb, EMILIELAM @gmail.com. So on the agenda tonight, I'm going to speak a bit about the Markham Stouffville Hospital Assessment Center and the expansion that's planned starting for next week. Dr. Jensen will speak about the North Durham Assessment Center. I'll speak a bit about Ontario Health Team influenza immunization strategy. Colleen will speak about both the Central and Central East Lynn program for housebound flu shots and swabbing. Then we have Dr. Yang speaking about drive-through immunization clinic flu shot clinic model. So first about the Markham Stouffville Hospital Assessment Center. So back in the spring and summer, through a whole bunch of different surveys, we knew that the vast majority of us primary care providers would not be able to see patients that had symptoms suspicious for COVID. And we were quite concerned that as we move towards the fall and winter seasons, that we're going to have a lot of undifferentiated flu-like illness, acute respiratory illness that would need an in-person assessment and a COVID swab. So at the beginning of August, through our Ontario Health Team, we put together a flu season planning working group that I co-chaired with Dr. Christina Popa from the hospital. And it was made up of representation from Markham Stouffville Hospital, family physicians, our community pediatricians, public health, and the Ontario Central Health Central Region and patient voice as well. And so we put together a proposal for an acute respiratory clinic. And the idea was really to expand the assessment center to provide clinical assessment for symptomatic patients, both adults and pediatric patients over the age of 6 months, with the idea that it would be staffed by family physicians, emergency department physicians, and it would be available by both self-referral or by physician referral. And that those who were very severely ill would actually continue to proceed to the emergency department. And that we would also have a continuation of the assessment center more for asymptomatic swabbing and potentially offer immunizations, and that asymptomatic swabbing being staffed by nurses and self-referral. Now things have changed quite a bit from that initial model. And we still are continuing with this idea of an expanded assessment center. The government has put a hold on the idea of an acute respiratory illness or influenza-like illness type clinics, but we're still going ahead with the idea of an expanded model. So I'll show you the blueprint for what is going to be launched next week. The go live date would be for October 14th. And the idea is right now our assessment center is outdoors in a tent and trailer on the south end of Markham Stouffville Hospital. As winter approaches, it's a little bit chilly out there, so we're going to bring in the assessment center indoors and create 10 bays for patients to be seen. And this is, for those of you who know the hospital, is where the cafeteria previously was with the Druxies. Just on the ground floor of the hospital. And this works quite well because the assessment center is actually just outside that area, outside the courtyard. So we're planning on providing a little bit of covering in the courtyard, and then patients can actually enter through from the courtyard into a reception area and then go to one of the 10 bays to be assessed. There was consideration if we could put in an x-ray or not. At this point, there is no x-ray capability. But if it was needed, we built in some space there, and then patients would then exit out a separate door. And this assessment center area would be staffed initially by one family physician or one emergency department physician, but could be staffed by upwards of 2 or 3 depending on the demands. No referral is required, but we are building in the ability for family doctors to fax a referral to the assessment center. This fax number, this is fresh today that we came up with. We found the fax number for this this new assessment center. So this will be emailed out later on. Patients still must call themselves to book an appointment or book online. So we're still working on that capability, and also working on the capability to notify primary care providers if you refer a patient and they didn't end up booking or didn't end up showing up at the clinic. We're also working on notification for if your patient was seen within the assessment center, that you get a similar alert as if the patient went to the emergency department. We're still wanting that continuity of care. So we still do recommend that that first point of contact for respiratory type illness be the primary care provider via virtual visit. And then sent to the assessment center as needed for further assessment. And then the follow-up after being seen within the assessment center would be back with their primary care provider virtually or via telephone. We put together a standardized discharge form, and this was put together again with input from family doctors, pediatricians, and our emergency department physicians. So this would be provided to every single patient being discharged from the assessment center with information on how to access your results and information on how to self-isolate. So those are the main updates I have for the Markham Stouffville Hospital Assessment Center and that expansion that's going to go live next week. If you had any questions, feel free to email me. If you had any interest in working in the assessment center, also feel free to email me. The schedule for this month and I believe next month is already put together, but if you're interested in helping out, please just give me a shout. Okay. So I'll move on to Dr. Jensen, who will talk about the North Durham CAC.
Great, thanks, Emily. So the North Durham CAC is actually, I think, pretty much what you're trying to create right now at Markham. We're just a couple months ahead. We opened in early August. So this picture here is me and the 3 other female co-leads of this clinic trying to do a bit of a Charlie's Angel pose there, which we used in our marketing to let our patients know that our clinic was open. So we've got Dr. Rebecca Ray. Dr. Jennifer Wilson is just behind me, standing up in a disco pose of sorts. And Dr. Mary Lee Brown is to my left there, and I'm the one squatting down. I used my space bar, but it doesn't do anything. Thank you. So in terms of like why we wanted to do this, so, you know, in Uxbridge, we the North, the real North, well, not really, not North Bay North, but we feel we're quite North. A lot of people in Uxbridge don't like to drive somewhere where there's more than one set of traffic lights, and I would include myself in that. And our closest place to go was either Markham or Ajax and Oshawa. So I've kind of put these cartoon noses on the map there as to where the different places you could go were. And there really isn't anywhere in the north where people could easily get a swab without with an appointment. So Port Perry is a community very similar in size to us here in Uxbridge. And the physicians there run Emerge as well as a small hospital and family medicine. And we were able to petition the Ontario Health to get a clinic that is jointly run between our two clinics. If you want to go ahead there, Emily. So this is the building that we're using. So it's actually a repurposed community hall where brownies and other type events occurred. There's just a small set of stairs at the front, but there actually is an elevator off to the side for people who are mobility impaired. However, in that scenario, what we found so far is it's actually easier for us to just come out into the parking lot and do the swab there. So our hours currently are 8 hours a day through the week, and then on the weekends it's for 4 hours. And we've got the ability to flex, and that actually has been proven to be very important, because we've certainly seen this ebb and flow in terms of referrals, where some days we were only having 100 to 200 people seeking appointments, and then other days it was up to 500. So we're sort of able to match that. Next slide. Okay, so in terms of how it works, so even before the ministry did away with same-day appointments, we actually had appointment-only based services. And the way that people can access a swab, and by the way, this is not postal code specific, so anybody can access this. In fact, we've had people from Mississauga come at one point because we had better wait times. covidswab.lh.ca, so LH being for Lakeridge Hospital. And you go onto an online website, and I've sort of just screenshot the first page there, and there's a series of questions that the patient will be asked to answer. And then based on how they answer those questions, they're given a slot. So there's different priorities given for different types of patients based on how they answer the questions. And then there's an algorithm that will fit them into different spots. Go ahead. So it takes only about 3 or 4 minutes to fill out all the questions. They do ask a fair amount of questions about symptoms because it's actually being used to collect a little bit of data as well. The only thing that the patient does need to have handy is their health card number and their family doctor's name and phone number. Now, if they don't, they can actually leave it blank. And as everyone knows, you don't need a health card to get a COVID swab. So, but if your patient gets hung up on that step, they can pass it. But ideally, they have that because then they're going to be able to look up the results themselves. At the very last page, which is what I've screenshot here on the side, the patient is then given the option of where they would like to have their swab done. So you can see there's multiple sites there, and actually there's a few more that are going to be added in the near future. At this time though, this is what the options are, or they can select first available, and then it gives them the next available spot for whatever priority they come up as. Okay, so a healthcare worker, for example, is a priority 1. So no matter what you click, you're probably going to get a pretty quick appointment time versus the person who is waiting to visit someone in long-term care who gets slotted a lower priority. And next slide. So in terms of the flow, what it feels like for your patient, or if you yourself ever have to visit this, the patient enters the building. There's a plexiglass window where they simply just hold up their health card, and we have a system that allows us to quickly find the patient, and then they're directed to one of 6 cubicles that are in the room. The assessment can be pretty straightforward, and it's either by myself or whatever physician is working or the nurse. If it's just, I need a swab, I normally wouldn't see the doctor for this, then literally that's all we do. And then we give them a handout very similar to the one that Emily showed earlier on how to get the results and how to self-isolate while they're waiting. However, if there's something more, more symptoms going on, or we're at all concerned, or the patient is febrile, then the physician is then asked to assess that patient, which may include, blood pressure, vitals, etc., and or a rapid strep swab. We don't have the ability to do portable x-rays at our site. Next slide. So in terms of referring, so first of all, you do not need to refer a patient, but you might want to refer a patient if you're hoping to get them priority access. Now, this is not supposed to be a backdoor way to sort of special treatment. This would be really for the patient that you are concerned about, that you would like assessed same day. Maybe a patient you normally would see in an urgent care walk-in, and you'd like to avoid having to send them to the emerge so they can get a same day assessment. So the email address is there. It's northdurhamcac@lh.ca. And that email address is monitored regularly by a clerk in the clinic. And then what will happen is the patient still has to go online, fill out that form, but then she or he will call that patient and say, we see you've been referred in as a priority, and they'll slot them in a same day slot. I mean, if it's 6 o'clock at night, we may not be able to accommodate that, but we'd certainly give them a quicker spot. If you wanted to refer in information, which I have had, so just yesterday I was working and one of my colleagues sent in a consult with a note. You can either attach that consult note to the email that you send in, because that email address is a secure email, or you can actually even send it in with the patient if they can have it emailed. We don't actually have a fax number, at least it's not as far as I'm aware, that it can be sent to. In terms of the results availability, the turnaround time is very much out of our hands, and so variable based on how many swabs are being done. But currently, the turnaround time to get an appointment time is approximately 66 hours. Earlier on, you would get an appointment sometimes same day or next day, and we're probably going to see that flex a little bit as time goes on, and we're going to try and match it by increasing our number of hours or the number of swabs we're doing per hour to keep our wait times low. Next slide. Oh, that's it. I didn't realize that was my last slide. So yeah, and then actually just one more thing before I move on to we move on to the immunization strategy. And that's just to let you know that we are in the works also of creating a pediatric assessment clinic that will be specific for PEDS cases. And that's going to be at the Whitby site. That will be coming in the near future. And again, it's just, we all will just want the best for our patients. And so in terms of like where they go, of course, within our catchment area is great. But sometimes if there's not something available yet within your catchment area, it's nice to know what's available around or if there's wait times. So I'll certainly be passing that information on to Emily, and she can probably put it up on our website for the PEDS clinic, where they'll be specifically following up children themselves. That's all I've got.
Great, thanks, Carly. So I'll move on to the our Ontario Health team, just the influenza immunization strategy for this fall season, and that's been quite the challenge because we knew that with any sort of vaccination in our community offices that we're going to have some difficulty getting the same number of people vaccinated as in previous years with all the distancing and the PPE. So again, we turned to that same working group and looking for a collaborative effort between multiple stakeholders in terms of identifying capacity in the system for how we try to get the most number of people flu shots this season. So some things with capacity, things like the pharmacies being able to provide the high dose flu shots to those over 65. We are looking at options for, what clinics might be offering some extra hours to the public. For example, the Markham Stouffville Urgent Care Center is offering extra hours for flu shots. Novel ideas for like a drive-through flu shot clinic, and you'll hear a bit more from Pearl about that a bit later in this webinar. And then looking at what resources we might have to do mobile flu shot clinics into congregate settings, or setting up a community kind of pediatric flu shot clinic. So in terms of what we heard from public health, so York Region Public Health has secured actually 25% more vaccine than in previous years, so more allocation. The allocation that goes to pharmacies is actually a different supply, so it doesn't impact public health supply. There's no publicly funded flu mist this year, but it's available private pay at the pharmacies. And we should have already been starting to receive our first allocation of flu shots as the distribution started this week, with the second allocation hopefully arriving late October, early November. And the direction we received from the Ministry of Health is that any large-scale immunization clinics that we plan on having, and we were looking at a pediatric flu shot clinic, would be placed on hold until we receive that second allocation to ensure that there's enough supply for the existing clinics. So any sort of larger scale community flu shot clinic probably won't take place until about mid-November. So within our Ontario Health team, really two main initiatives we're looking at. One is doing mobile flu shots into congregate settings that are in need. So whether they're retirement homes, group homes, seniors residences, shelters. So we've already made some initial calls into congregate settings to determine which are needing flu shots delivered to them. And we've worked closely with Health for All Family Health Team, which is our academic family health team in Markham. And they have a program called REACT that has allied health professionals, multidisciplinary team. And they're able to go out and assist in the delivery of these flu shots. We were looking at doing a pediatric flu shot clinic based on the feedback that we received from our community pediatricians, who are also quite concerned that they won't be able to vaccinate the same number of patients they have in previous years. And we know that our pharmacies can't vaccinate those between the ages of 6 months and 5 years. So really there's a gap in this vulnerable pediatric population. So we formed a partnership with Health for All, Markham Family Health Team, and Public Health to look at delivering a pediatric flu shot clinic out of Cornell Community Center. And Markham Stouffville Hospital is helping us out with that as well, in terms of connecting us with the community center, since they're already using part of the community center themselves to help source some of the extra supplies that they've had. So we should have access to that community center, but again, we wouldn't be able to set up any sort of flu shot clinic until about mid-November, after we get that second allocation from public health of the flu shots. Okay, so that's all I had. And then so Colleen's going to talk a little bit about the Local Health Integration Network's housebound seasonal flu shot program.
Okay, thank you, Emily. Good evening, everyone. Thank you for inviting me to talk about the Home and Community Care Flu Shot program this year, as well as the in-home COVID testing program. On the line with us today, we also have Sandra Armstrong from Central East Lynn. She did collaborate with me for these slides so that I'm able to speak to both the Central Lynn process as well as Central East Lynn process. The next slide. My goal this evening is to provide you with enough detail to refer your homebound patients for the influenza shot, as well as outline what you need to include on that referral to make sure that the process goes smoothly, as well as what to expect when it comes to the timelines for both the flu shot and the COVID testing. We do rely on primary care to identify appropriate patients for home and community care programs. At a glance, the process from the primary care's perspective is to identify homebound patients who require a flu shot, obtain the patient's consent, complete the medical referral or the medical orders, and fax it over to the LHIN. I'll go into detail on each of these steps, highlighting what the process is for both Central Lynn and Central East Lynn. Though they're mostly the same, the process, there are a few minor differences. If you could go to the next slide, okay. The main criteria for the seasonal flu shot program eligibility really is that the patient is housebound or homebound. That is, they're unable to physically leave their home to access either family physician, pharmacy, or a clinic site for immunization. Our care coordinators proactively review their caseloads to identify any of their patients who are homebound and meet the flu shot criteria. You may have care coordinators starting to reach out to you, primary care providers, to request a medical referral to be sent to the LHIN. The central LHIN does require that a medical referral is sent over, and that the reason for that is that we don't have a medical directive in place for all of our patients. However, at Central East LHIN, medical referral is not required, but it is preferred. This year, we will accept new referrals for homebound patients who require a flu shot by referral. We will also assess those patients to determine if they need any other services. We are accepting referrals for pediatric patients also who are homebound or medically complex. For pediatric patients, it is important to know whether the child is receiving the flu shot for the first time. This will help the nurse determine if a second dose is required. And we ask that that information is included on the medical referral. And in those cases where 2 flu shots are required, we also ask that the LHIN nurse is providing both of those doses rather than just one. If you could go to the next slide. Okay, wherever the patient calls home is where the flu shot will be provided. Our flu shots, our clinic sites do not currently provide flu shots. Instead, we ask all mobile patients to be referred to alternative sources. High dose vaccine, it will be available to through our nurses, and we ask that that's also included on the medical order. The high dose vaccine is also based on availability. And so I think that piece is important to communicate to the patient. If the flu shot high dose is not available at the time of the home visit or the appointment, the nurse will, in consultation with primary care, proceed with providing the adult dose. And that is a practice that is supported by public health. Again, that will be in consultation with primary care. Our flu shot program will begin as soon as the serum is received by our nursing service provider, and we will end the program on January 31st. We ask that primary care does start to send in the referrals as soon as possible so that we can get patients lined up and launch as soon as possible as well. The service provider in the central LHIN area is SE Health, which is St. Elizabeth Health. And in Central East, they're still looking for a service provider. So this slide really speaks to the referral process. And our process, it is important to us to make sure that patients receive a timely immunization. As I mentioned previously, our care coordinators, they will review their caseloads, identifying patients who do require a flu shot. And we follow our regular intake process to assign a provider. On this slide, you'll notice that both the Central and Central East fax numbers are provided, simply faxing over the medical referral. And you could expect that the timeline from sending over the referral to receiving the flu shot will be about 7 to 10 days. And of course, that is dependent upon vaccine availability. Referral forms are always posted on our website, and that's also linked within this slide as well. On the next slide. This slide shows a sample of the medical referral form. I've highlighted a few areas that are really important for us to ensure that the process is smooth and it's a seamless experience for our patients. So firstly, completing all of the patient demographics and allergies, and the treatment order should include the type of flu shot, the dose, the number of doses that are required, specifically important for pediatrics. That's highlighted in red on this slide. as well the prescriber's signature, phone number, and name in case any follow-up is required. For all referrals, patient consent really should be obtained. And at the time of obtaining consent, we do ask that primary care explain to patients where the high dose is indicated that the adult dose may be provided if high dose is not available at the time of the visit. All patients should expect that the nurse will call ahead and make arrangements for an appropriate time and suitable time for the home visit. Okay, moving on to the next slide. So I'm happy to share that COVID testing is available for homebound patients, and it is available through both Central LHIN and Central East LHIN. Similar criteria is for COVID testing as for the flu shots. Patients really must be homebound, and we do follow the same guidelines, the testing criteria as the assessment centers. Any asymptomatic patients should really be referred to pharmacies. To initiate the COVID testing process, we ask that a Ministry of Health lab requisition form is sent from primary care to the LHIN using the same process as I reviewed on the previous slide, simply faxing into our intake line. On the next slide. For patients who meet the eligibility criteria, a trained LHIN RN or NP will be assigned to the patient, and they will call the patient and arrange a time for the visit. The LHIN lab provider will arrange for pickup of the specimen, or the family can choose to bring the specimen into a Life Labs along with the requisition and the public health requisition. It's important to note that we do prioritize patients who require COVID testing for transition into long-term care, or for patients who require COVID testing for a medical procedure. Next slide. On the slide, I have the referral information and details for both Central LHIN and Central East LHIN. Across the province, there are about 120,000 home care visits made to patients in their home every day. And beyond the flu shot and COVID testing, home and community care services do continue to be available for patients that need services in their homes. So our websites with the referral forms are linked here and always available. And that's it. I thank you for inviting me to the presentation, and wishing everyone happy Thanksgiving as well.
Perfect. Thanks, Colleen.
Hi, it's Sandra. I'm on the line as well. I couldn't get in through the Zoom meeting, so I am on the phone. And thank you, Colleen, for taking the lead for that presentation. I appreciate it.
Sandra is Colleen's colleague in the Central East LHIN. So we'll move on to Dr. Yang's presentation.
All right. Right. Thanks, Emily, for inviting me to give this talk about our drive-through immunization clinics happening at Stouffville Medical Center. So I hope this presentation can help other clinics try to start their own drive-through, either for regular immunizations or for the flu clinics that are upcoming. And I'm trying to hopefully get you some suggestions from lessons that we've learned over the last few months. So why drive-through? So back in March, when everything basically blew up, I think closing down clinics, trying to stop the traffic from coming into the office and stopping the spread just made us have to think of another model of how we could deliver immunizations to our patients. And besides that, just having a global shortage of PPE, we needed to be able to conserve, so that we all thought of what could we do for our patients that needed the immunizations. So advantages of the drive-through were that we could increase the number of patients that we could see per hour and increase our vaccine efficiency and immunity in the community practice while decreasing our use of PPE and sanitizing, and basically helping to just administer what needed to still be administered even with everything else that was going around. So we continue to give our childhood vaccinations for pregnant patients, and for severe nutritional or elemental or hormonal deficiencies. Anything that we couldn't give orally, basically, that was trialed would come through our immunization clinic, and other vaccines that required to be different ones to be given in a timely manner, like Shingrix or Hep. So to be eligible for the drive-through, we said that every patient had to have their virtual visit already. They would have had to set that up and do their well baby visit, or at least talk to their doctor about the immunizations that they would be receiving. So hopefully most of their questions and concerns were addressed by their family doctor. And then once they got to our clinic, then it was more just a jab and go. They could come in and come out, and it wouldn't be too labor intensive in time. So how do you do this? How do you make it flow through your clinic? Basically, what we set up was that a doctor would complete the virtual visit. They would then message a designated administrator to book into the clinic. So a message would be like, this six-month-old needs PDSL and Rototec. This administrator would then book into a clinic that we decided were, at the time, no one was working, basically. So it was on a Thursday morning, a weekday morning. And later, because of demand, we increased it to, we tried to do on a weekend. But basically booking 2 doctors with 2 cars every 5 minutes, and we alternate between adults and adult and child, just for timing's sake. Children take longer to take out of the car seat and everything. So this seemed to have worked really well for us. So before your clinic, we would close bookings basically a few days, 3 to 4 days before the immunization day. And one person, which was me, would just be designated to look through every chart, just to confirm that every vaccine visit was documented. So they talked to their doctor about it. Just confirm the timing of the vaccine. So is it the 2-month, the 4-month, the 6-month, 18, 15, or whatever it was that it was confirmed. And any suggestions were sent to the doctor, who was their usual family doctor. And this review was documented, and then a master list could be made, and then our dash sheet. So our dash sheet is something that we would email to every patient, so that we wouldn't actually have to go in and ask them all the questions of who are you, what time, and through the booking, we just had to look at this sheet, and we had all the information we needed. We had their name, we had the doctor's initials, so whoever was going to be administering that vaccine, the date, the time, and the vaccination they were to receive, and allowing a space on the dash sheet so that if it goes into the glass, you could still see everything. So besides that, we would email the patients prior to them coming. So this is where they would get information on what to do on immunization day, bring their dash sheets, have something for their children if necessary for feeding and just to settle, and as well how to drape the patient appropriately, so it would be a quick throughput into the clinic. Second part of the email would be self-screening for symptoms. So basically saying if there was anybody who was unwell, who had a fever, who had certain symptoms, runny nose, cough, sore throat, that they wouldn't come. They would have to cancel and then follow up on another day once they were well. And finally, we also had post-vaccination instructions. So they could watch for symptoms afterwards, tips on medication, and then parking post-vaccination if this was especially a first-time vaccination, that they would have a space to stay for 15 minutes. And if they were to have any problems, they should contact us. Just let us know and we'd come to see them. Otherwise, after that period, they could go off and just drive away. And we also had our consent emailed. So by attending your scheduled appointment at our clinic, you provide consent to receiving these immunizations and understand the risks and benefits that have been discussed with your family doctor. So they would come to us. We also email this map to come to Stouffville Medical Center. And finally, on the day, they would arrive. So before they arrive, sorry, we would prepare their vaccinations. We would have all the vaccine counts tallied We have a couple coolers that with our thermometers, we know that we keep between 2 and 8 degrees, under 8 degrees. And each individual had boxes prepared with each of their vaccinations. And one doctor and one other individual had to confirm all the vaccines that were put in each box before they were sealed, with another final review to match the boxes to the schedule that we had. So this is an example of what our patient box would look like, with the label on the inside and on the outside, with the vaccines, an alcohol swab per vaccine, Band-Aids for children, and gauze in there as well. And finally, when we line them all up, we put them into our coolers in backward chronological time, so that the ones that we saw first are right at the top, the ones that later were at the bottom. Finally, equipment that you'd have at each station. So we had a couple rolling carts. We'd put the vaccines in the cooler and on top, and have our sharps bin, everything you need, as you can see there. You're sanitizing a chair at each station, so that people who had a car that you just couldn't sit in properly and give the vaccine, they could actually come out and sit, and then we'd sanitize it after each person that would go there. We had extra PPE, extra everything, gauze, alcohol, and tips even, just in case. So physically, our setup at Stouffville Medical Center, we're very fortunate to have had this. This is like made for drive-through immunization, basically. You have a nice covered area, 2 lanes can go, two cars can go through at one time. And we set up each station on either side. So just before each morning, we would have someone park on one end, and then have a pylon that we acquired put on the other side, so that the room was basically, the area was clear of any other cars. And that's our station on one side. And basically, with 2 cars there, we have plenty of room. We have the one doctor and one assistant approach, and both of us confirm that the dash sheet and the individual matched the actual box and label that would have all their vaccines in there. So people that you need for this, we had always 2 physicians doing it at the same time with the 2 assistants. And then one person that you don't see there that would be checking in the individuals. It's just having them go to either doctor on each side by the initials of the doctor on the dash sheet, and managing traffic flow, so that people would wait and turn off their car every time that they get to the front, so that we don't have too much gas in the area. So our first immunization clinic was April 9th, and it was great. It was a success. And we learned lots from that day, starting with kids. So with childhood vaccinations, basically we came out to a formula of 2, 4, and 6 months. The kids would stay buckled in their seat, and parents would just remove them from the car. So put the bucket seat basically on the ground, and we would just administer to the thighs and give the Rototec to the parent to administer later. So they would basically get the immunizations and then park in our lot and give it to the baby. Between 12 and 18 months, the child usually comes out and sits in the driver's lap or the passenger's lap, and then we would give it to them just sitting there. And 4 to 6 years, depending on how the child was, we'd either just administer it right in their booster seat, or again on the parent's lap. So other things to think about. I remember we did one immunization clinic in the morning, and then I had a person who couldn't actually make it to that clinic, so then did a walk-in with me. And luckily they were in the clinic when I gave it to them, because as they were sitting there 10 minutes later, fell on the floor and passed out. So thank God they were not in the car. So from that point on, we basically made sure that you had to be without any previous reaction to immunizations or any other medical procedures. So this person did have a history of fainting or of not tolerating vaccines very well. So we do not take anyone through drive-through that has any type of reaction or have had a history of syncope or pre-syncope, and we don't do any allergy shots, just because the nature of allergy shots is that they're getting it because they have like a greater reaction to it. So we wouldn't want anyone to have a reaction to what they get in their car or while they're driving. So all the people who are ineligible are provided with walk-in options, and they can just see their doctor. So we started this in April, and as you can see, it was definitely single digits when we started. So it was cold. By 15 or 20 minutes in, you almost can't feel your fingers. So we started to pre-cut our even our alcohol swabs so that they were open, the packets, and opening up our Band-Aids so you didn't have to fuddle with it as you were right after the immunization. Those are things that you need to consider, and always having shelter somewhere, because sometimes when it was really cold, you didn't want your babies also to be cold as they were getting their vaccinations, or anyone else. So we'd have a corner that was the least windy that we'd take the bucket seats to, give them the immunization, and then have them go. So an open space area might be a bit tough for some of these individuals, depending on your weather as well. Traffic flow. So having a separate entrance and exit, I think, is key. So you don't have people stuck in lanes here and there. If you can have 2 lanes and 2 docks, it makes things just that much more faster. Blocking off the area helps. Any parked cars in the way when they have to leave, or people coming, it just stops, again, your flow. So trying to limit that, perhaps doing it on the weekend or first thing in the morning when you can block the area off. So making sure you let management know and other tenants of what you're doing, and just booking light to start out when you're doing this. And then you can always just, you can increase later on and by knowing how many cars are in queue. When you get to have 3 or 4 in line, perhaps then decrease. Turning off the engines and just having parking available after the vaccine. So now with thinking about flu, which I'll talk about just in a little bit, making sure you have enough space for all the people that have to wait for the 15 minutes. So we were doing these every 2 weeks, and we found that sufficient. We could keep up with the number that were coming in, and was basically pretty equal between weeks. Again, weekday mornings between April and September, and then once September started, when school started, we had to offer a weekend and an evening. So right now, the weekday evenings are still tough with the traffic, but we're still trying this out. So we started off with I think back and I think, wow, this took us so long. 23 patients for 2 doctors in 3 hours. We were really conservative in our bookings. Then 2 weeks later, we had 35. And the clinic this morning, we had 50, but we were down to about just over 1 hour. So we went from 1 to 2 patients every 15 minutes to about 2 patients every 5 minutes per doctor. So you can really increase your efficiency with this model. We're getting referrals from other clinics to do children especially, and the only downside is that when we were doing this, it's just taking just a lot of hours of preparation. So, in thinking, how do we speed that up? This is me preparing for the clinic. I approached a software person to say, you know, I just need to do the exact same thing each time, basically make dash sheets, make labels, and I'd love a master list. So how do we do that? So he created a tool that we could enter basically some information and get everything we needed spit out. So this decreased from, this basically cut down time to preparation to a quarter of what it was. And getting a list and getting labels to put on each of the boxes so that it had basically everything on the dash sheet, the name, the time, the doctor, and we could confirm the vaccines that would be put in each box on the label. I think that is key. So, and the dash sheet was also automated too, so that everything was spit out all at once. Having your vaccine count ahead of time also helps you to just make sure that you have what you need for each patient that's coming in, and the ability to cancel if you need to ahead of time if you don't have that in stock. So I think the best comment was, you guys are faster than Tim Hortons. So that was great. So how do we make this into a drive-through flu clinic, basically? I think everyone's waiting on that. So it's actually not very different. Similarities are a venue. Definitely have to have a good venue with drive-through capacity, and really consider yourselves, consider the weather. You're gonna need something sheltered and covered. Have your doctors and assistants, get your vaccine cart and supplies out, get your email consent so that you can send the consent to the patients, or think about having online consents on your website. Considerations for traffic flow, administering the vaccines in the same fashion, and just making sure you're always thinking about the cold chain for storage. So differences, things to be considered are having that larger parking area so that you can accommodate the wait for 15 minutes. And being able to think about how you're going to get a person to respond to something that might happen in the parking lot in an adverse event. So making sure you have your EpiPen nearby, like your emergency cart, and a place that they could go. One good thing is that you're only drawing up then 1 or 2 different vaccines, either regular or high dose. And you could always pre-register so that you can know how many vaccines that you're going to be ordering in the future. So vaccine prep is also different. You can either do it on site, like not ahead of time, or as the clinic runs, or like a rolling preparation, which I'll go through in a little bit. And the difference for vaccines, you want to try to, for these flu vaccines, I'm sure you want to try to get as many people through as possible. So how do you actually do this mass booking, and particularly of non-rostered patients in your practice, if we're trying to help everyone just get immunity? So with the 15 minutes, we made a little sheet there, a cheat sheet for our happy time ticketer. What she does is when people drive through and receive their flu vaccine, we have a preset time list, so you don't even have to think and do math on the fly. If they receive their vaccine, say at like 12 o'clock, then it says you put 12:15 on a sticky note and you give that to the driver and you say, okay, if you don't mind to park, and then when it's 12:15, then you're allowed to go at that time and give us a honk or come get us if you need anything in the meantime. So this would be just wait times. How long do I have to wait? This would be something that we put on a clipboard for that time ticketer who's giving those sticky notes and writing down the time for them that they can be dismissed, basically. So, and in prepping the vaccines, so either you can pre-draw in blocks, and I know public health wants us to draw up as close to the time that you actually administer, knowing that the stability of the vaccine once it's in the syringe is basically unknown. And so best to do it as quickly as possible. But we know that for efficiency's sake, you probably will have to draw up in blocks. One way to try to decrease the time between draw and administration is to hopefully have like a partnership, basically, in 2 or 3 rotating MDs. What we did today, we had our first flu vaccine drive-through today, is that one doctor would draw up about 20 minutes worth, so maybe 40 vaccines in supply, and go out and administer, while another one would stay behind and then start to draw up their own, and then they'd switch so that you just keep on having a fresh supply out there. And that seemed to work well today. Booking. So how do you book? Today we did a phone booking because we were just kind of feeling things out, and that's good. It's easy to have them on a list. You can get a master list printed out and then easy to bill from later on. But it's highly intensive on your front staff. So then you could consider online booking or online booking tools like Ocean, or someone introduced myflushot.ca to me. You could look on that. You can register and they have a webinar. But what we will be using, we haven't set that up yet, but we're in the midst of doing it. We're going to be using Eventbrite. So Eventbrite is used internationally. It's probably been around for about 20 years. We check the privacy statements online, and so they're secure. They're secure enough to hold your credit card information. So they're secure enough to actually have your name and your first name, last name, and just an email for us. We're not asking for any other information, no health card, nothing. So it's just first name, last name, and some way to contact them. Through Eventbrite, we'll be able to get a list of people who'll be coming. You get an app on your phone that can update you on how many people that have registered, so then you can match it up to your actual vaccine supply. The other advantage for this would be that if you get their organizer app on your phone, then you also have a check-in. A quick check-in. So you basically scan a code and then they're in, and then you can print out who attended by the end. You know exactly what time they checked in, so basically what time they were administered their vaccine, and after that you are golden. So one thing that was brought to my attention from public health just this past week was once it dips below 0, so freezing temperatures are not good for flu vaccines. Basically, if your flu vaccine supply gets frozen, you're not supposed to use that anymore. So we're good in October, 13 and 3 degrees, but look at November, we're starting to dip below 0. So drive-through isn't quite the best option starting in November. We will have to look through walk-through options. So we were thinking in our clinic, what are we going to do? Because we don't want to increase traffic, but we still want to mass vaccinate as much as we can to our population and to the greater region. So who are you going to call? We call our mayor. Mayor Ian Lovett. He's been excellent with us in helping us try to figure this out. And he was totally supportive and said, okay, let me think about it. Let me find a venue. We finally came up with Soccer City. So walking through, it has an excellent drive-through option on the front. It has parking space galore because no one's using it right now, it's closed. And it also even has a walk-in option. So in the upstairs area and the downstairs area, there's a throughput place with even tables already preset, so we could all set up there and have a place for people to sit 15 minutes and then a separate exit. So it looked amazing. We were very happy about that. So what I was thinking to do was actually to make this a multi-practice flu vaccine clinic. So anybody who can't organize a drive-through in their actual clinic can help, can use this area that we can book together and try to schedule together and make it a multi-practice clinic. So we would start with a hotspot, which basically would bring signal, internet signal that we could use to anybody who brings their laptop in. Every doc who comes in could access their EMR separately. So, oops, sorry. So I would get into my PSS, you could get into your Acura, whatever you needed, but anybody who can access their EMR online can bring their laptop and then run their clinic there. Bring one of your card readers, and for your rostered patients or non-rostered patients, you have information that goes directly from their health card into your EMR, so you don't have to worry about about security on your laptop as well. And then you have the name of the person, you have their health card on your EMR, and you're golden. So we all see all of our flu patients, and we're all happy. So if anyone is thinking about a drive-through or can't do their drive-through in their own clinic, happy to connect with you and see how we can arrange to do this together. So you have to have an amazing team to be able to do something like this. And I am so grateful that I have the most amazing team ever, especially Arlene Raymer, who is our best office manager. And she has just been positive. Whenever I say, what do you think about drive-through? Or what do you think about a larger drive-through? She never just shuts it down. She says, okay, what do we need to do? How should we do it? So, and having staff that also back you up and are willing to do these larger clinics have been amazing. So thanks to all my staff and Arlene and the residents that have been helping, and also our mayor, Ian Lovett, who's just been great. So good luck with your drive-through. If I can be of any help with you for that, let me know. Thank you very much.
Thank you for that, Pearl. All that organization you've done. So congratulations on a really awesome model, and looking forward to hearing more, especially this idea with a multi-clinic flu shot area. So that is pretty neat.
Thank you.
I guess if anyone wanted to get in touch with Pearl and didn't have her information, you can feel free to email me. My email should be on the screen again now. If there were any questions, feel free to put them in the Q&A. We already answered some of them just via, just through the Q&A section, typed answers. So you can check that part out. But were there any questions? So either through the Q&A, or I'm just checking the chat as well to see if there's anything.
I only think it just might, Emily, be worthwhile to mention the one question was about whether assessment at either of these clinics negates your access bonus. Just in case people don't look at the questions that were answered or don't know how to check them, it does not. Okay, so there's sessional fees that run that cover the fees for the physician, and so it's much like your patient going to the Emerge. Now a flu shot clinic might be a little bit different, but certainly if your patient is seen at the Markham Clinic or at the North Durham Clinic or any CAC clinic, it does not affect your access bonus.
And thank you for that, Carly. So yes, so both our North Durham and our Markham Stouffville Assessment Center, the H codes, and for anyone who's interested in working there, is an hourly code at $170 an hour during regular Monday to Friday daytime hours, evenings and weekends pay at $220 an hour. And so there's no negation with that. And in terms of, there was a question about flu shot clinics, if flu shots would end up negating faux physicians. My understanding is that if you bill just as flu shots as the sole reason for your visit, the G590, it is an out of basket code. So all of us faux physicians get the full amount of that code, and it does not negate. Now, if someone decides to bill an A001 with a flu shot, then the A001 would negate. But otherwise, a flu shot only clinic should just be a sole visit and would not negate. There's a question, maybe good for Pearl, is what about screening for COVID at indoor clinics? So I guess if you're doing an indoor flu shot clinic, how would you screen?
So we have a screening questionnaire, and we basically have online when they register and try to get their ticket, they have to click that they've read through each of the screening questionnaires. So one of them would be for COVID symptoms. So basically everyone is encouraged only to come if they are well for theirs. And so when they get there though, we're not going to do actual like temperature screening, or it's just going to be purely on their ticket.
Thank you. And then another question for Pearl. For healthy adults, is it reasonable or safe to administer flu shot while the patient is standing up?
Good question. I think for people who've had their flu vaccine and they're known to have vaccines in the past and no reaction, which is what we're looking for, then we'll always provide a place that they could sit if they'd like to sit. And at the table where would be the walk-in, there are tables and chairs there that they can sit and have their flu vaccine. We've done mobile clinics where people are standing and they get the shot and they go. So we've done hundreds actually in that way and have not had an issue. Usually people know if they've had a reaction before that they're going to sit or they're going to say, can I lie down? And we'll have that available for them too at that walk-in.
Thank you. I have a question actually for Colleen. You mentioned that the case managers would be looking at their caseloads to see which patients are housebound and could use a flu shot. How is that information communicated back to the family physicians? Is it different between the Central and Central East? Because you alluded to the fact that there might be already a directive in the Central East, Lynn?
Yeah, oh, good question. The process will be the same for Central Lynn and Central East. Care coordinators will connect with primary care to discuss the flu shot. For Central Lynn, we will ask for the order to be sent, but for Central East, it will simply be a conversation.
So a phone call or usually a fax, would you say?
Yeah, phone call or fax.
Okay, thanks. Can flu shot and Shingrix be given at the same time? My understanding would be yes.
Yeah, that's my question. I was talking to Adam about that too. Is it an issue? Is it not an issue?
Yes, they can be, but I don't like to do that. I say to split them up just because Shingrix, 50% of people are going to have a reaction to that. Either it's something mild or something not so mild. And so adding the flu on top of that, I can't see that being a good thing. Plus, if you're going to try to get a heightened immune response to the Shingrix, why are you adding something else at the same time? So just split them up is my suggestion, in my humble opinion.
There's a question about how to refer patients to your vaccine clinic. Pearl.
So we will have a link on our website, Eventbrite. Well, you can sign up that way. And I was talking to the mayor, and he said that he'll also send something out, likely social media. And otherwise, I don't know, Emily, if you have any other suggestions of where we could put a link, then happy to have more people join. Perfect.
Maybe, yeah, we could consider the our OHT website. Maybe if you want to email me the information for that, that'd be great. Okay, and Christina has an email, a question that I don't know that I have the answer to, and maybe one of our panelists, if anyone knows, how to get a COVID test with a result within 3 days for someone who needs to travel in the next 72 hours.
As far as I know, it's not publicly funded, and also private funded. I overheard like Doug Ford recently sort of didn't quite outlaw it, but like if an industry, like I know the film industry has their own set of swabs because I have patients who are doing that, and the NHL does as well. But for someone who doesn't have it available to them through work, there's no way to expedite it because they all go to various labs and they all have slightly different turnaround times, and it really depends on the number of swabs that are sent each day. So I'm not sure what you're going to do for your patients except that.
Thanks. Another question for Pearl. Can you clarify again how you use Eventbrite and how you then enter them into the EMR? Is it manually done?
So Eventbrite is the ticket. So everyone has to bring their ticket and their health card. So the Eventbrite is purely just going to be their ticket to receive the vaccine. And then when they get there, if they're not registered as a patient, you can have a laptop set up with access to EMR over the internet, and then just use a card reader, and then you can either make a new file or enter them, and that's how you'd enter their actual health information. So I don't want to put any type of other information on the Eventbrite because of personal and privacy information, right? So yeah, you have to connect both. Someone has to bring the ticket and their health card to the clinic.
Perfect, thanks. And Pearl, I had a question for you about your dash sheet. How was that generated? Was that something that was manual, or you had some sort of automatic way of generating that?
So originally it was manual. It was me on with a Word document, and I made it into a PDF, and you email it out. And then afterwards it was through just a tool, basically like a software tool that we built that would generate them automatically.
Thanks. And then there was a question about what you build for your drive-through immunization clinic.
Sorry,
what do you bill through a drive-through flu shot clinic?
Just the same as you do from a regular, like you do the G590 and the Q590. Yeah.
Perfect. Honestly, with the amount of work you put into that, I feel like you need like an A on there somewhere. No, I'm serious. Like that looked like a lot of work. I mean, totally worth it, but I can see the question. I was wondering the same thing. Like, I mean, we don't like to think of ourselves as a business, but we are. And you had to pay all your staff, and you had to pay your clerical, and I'm sure your hourly rate on that Word document until you had that figured out was probably an issue. It might be something worthwhile looking into. Like there are like, special fees that are available if I go to someone's house. So if we made some sort of special accommodation, anyway, just a thought.
We'll talk after.
Okay, any other questions, and any questions from any of the panelists here? Pretty good. Okay, so this presentation I will email it out when I have a link to it. If you had any other questions, feel free to email me. Otherwise, I think we're good here, and thank you all for joining us, and hope everyone has a good evening.
Thank you.